Welcome back to lecture 2 of the cardiovascular system. Um, heart anatomy is complicated, and sometimes a simpler drawing is helpful. I do have some simpler diagrams later in the content here, but we're going to take a look at some of the internal anatomy. Now we looked at external anatomy. Remember, the heart's got atria and ventricles, and we're going to look at a little detail here at the right atrium. So the right atrium, of course, is taking blood in from the vena cava, superior and inferior, right? The superior carries blood down from the upper body, and then the inferior is taking blood from the systemic circulation, the abdominal cavity, and the legs, etc. And that blood is pouring in through the sinus. So there's the pulmonary sinus, the vena cava, the sinus for the vena cava, and then there's also this coronary sinus. Okay, and the coronary sinus is bringing blood from the venous supply to the heart. Now, between the right atrium and the left atrium is this thin wall called the intraatrial septum. Okay, so that's up in this region here. That's between the atria of the right and the left. There is a cusp between the atrium and the ventricle, the atrioventricular valve, and on the right side it's called the tricuspid valve, the tricuspid. And that's because it's got three little cusps, and you're going to see them exactly in gory detail in a few minutes here. And the valves are made up of dense connective tissue, and they're covered by endocardium, and they're prone to disease and wear and tear. Blood travels through the tricuspid valve, moves into the right ventricle. And the right ventricle, the cusp of the tricuspid valve are actually connected to these muscles here called the papillary muscles. And they're connected with these tendons called the chordae tendineae. And these are really critical because as the atria most of the blood flows down out of the atria just due to gravity, right? So blood's flowing down as it moves from the atria to the ventricle here. When these muscles contract, they actually pull these things, they pull this valve shut. Why would you do that? Well, look, when this ventricle contracts, you're trying to push blood up. So there's a lot of pressure created here. And when these things pull down, they actually close this valve tightly because one of the big problems is when a ventricle contracts, it can blow blood back in through and back into the atrium, and that decreases the efficiency of the pump. Okay, so here we are, right atrium, the tricuspid valve, chordae tendineae, papillary muscles, and this is the right ventricle. Now the right ventricle pumps blood to the pulmonary artery. Okay, and this bifurcates. This is called the pulmonary trunk here. It bifurcates into the right and left branches. Left and right branches. And this valve here is called the pulmonary semilunar valve. Semilunar valve because of its shape as well. So it's half moon. Left atrium, you see the same sort of thing happening. I'm taking blood here from the pulmonary vein. Now the pulmonary veins notable because it's carrying in richly oxygenated blue blood, right? Remember that I said that most of the time arteries are carrying richly oxygenated red blood, except for the pulmonary artery. Most of the time veins are taking deoxygenated blue blood. It's not really blue, but we say that. The pulmonary vein is the counterpoint. Pulmonary artery is a counterpoint. What's true about arteries and veins is that arteries always take blood away from the heart. Veins always take blood to the heart. Anyway, pulmonary vein brings blood to the left atrium. This valve, the AV valve between the left atrium and left ventricle, is called the bicuspid valve. It has chordae tendineae. It has papillary muscles. When the left ventricle contracts, it pumps blood into the aorta. The valve here is called the aortic semilunar valve. Now, remember, the left ventricle is where really the real action of the heart happens. I don't love this illustration here. Remember that the left ventricular wall is much thicker than the right. I think there's some dimensional inaccuracies here, but um, it's just another way to look at it. Well, let's look at these valves in some detail. Hey, guess which valve this is? It's a tricuspid valve. This is actually a synthetic tricuspid valves, and valve disease is a common form of heart disease. So remember that the tricuspid valve is right. The bicuspid or mitral valve is on the left. And I think one of the things I missed here was LAM, okay? So LAM is for left atrioventricular or mitral valve, also a bicuspid. So this is the tricuspid, it's in the right ventricle, and down here I can see an example of a bicuspid valve or mitral valve. Tricuspid, bicuspid. Bicuspid is also called the mitral valve. Remember, the aortic and the pulmonary valves are these semilunar valves, and they're taking blood out into the pulmonary artery and aorta. So it seems counterintuitive, right? If I pull these muscles down, you would think it would open the valves, but actually it's the opposite. So as these muscles contract and the chordae tendineae push tension here, it actually causes these valves to close up. And having these valves closed is really important, because the worst thing that I can have happen is to have these high pressures generated in the ventricles allow blood to be blown back into the atria. All right. So, the whole job of the ventricles is to push blood out to the pulmonary circuit in the case of the right ventricle, or the systemic circuit in terms of for the left ventricle. And so damage to heart muscle, papillary muscles, to the chordae tendineae, to the valves themselves lead to disease. And the worst of the diseases is mitral valve. So remember, the mitral valve's in the left ventricle. It's the bicuspid valve. And there's lots of pressure in there. And so over time, if you have unregulated high blood pressure, if you have a condition called megacardia, if you have been exposed to viruses, if you have been exposed to bacterial infections, you might end up with mitral valve disease. Now, remember, we learned about how the endocardium of the heart is susceptible to infections. And of course, these valves are covered with the endocardium. And so some bacterial infections, like the bacterium from Lyme disease, can cause that. Lots of viral infections can cause valve disease. So scarlet fever is associated with valve disease. I think measles is as well. And once those valves have been damaged, you end up with inefficient cardiac function. And cardiac output is really important. This is an echocardiogram, and it can show you blood being blown past those valves. Worst case scenario is that the chordae tendineae and the valves have become so damaged is that you have what's called a prolapse. And a prolapse can happen in lots of places in your body, but it's like when things come out where they're not supposed to come out. So mitral valve prolapse occurs when the mitral valves are actually blown back up into the atria. We could also have stenosis, and you see stenosis in these semilunar valves more often. So as the valves swell, whether it's the endocardium causing the swelling or the pericardium causing swelling, you can have aortic valve stenosis is a common type of semilunar valve disease. And so that inability for the valve to open also reduces cardiac output. Okay, so in aortic valve stenosis, right, as that aortic valve fails to open, as it's sort of swollen shut, it just creates greater and greater pressures in the left ventricle. And in the end, that's a bad thing. In the end, what the disease causes is it's called megacardia. You get a really big heart. And you might think that having a big heart would be a good thing, but in fact, there's always this economy. And so at a certain point, the bigger you get, as that heart muscle works harder and harder, the less efficient it becomes. And of course, this is what leads to congestive heart failure. Congestive heart failure is an accumulation, ends up with a bunch of things, an accumulation of fluid around the heart, and it's just a perfect example of what we call those passive or positive feedback loops. Now, the valves are part of this internal skeleton or internal capsule of the heart, and it's kind of fascinating. There's there's cardiac muscle, the myocardium, right? And there's endocardium, this epithelial tissue, but there's also this dense CT skeleton. And if you use a detergent like sodium dodecyl sulfate and you wash and wash and wash an organ, you can wash off the cells of the myocardium and wash off the epithelial cells, and you're left with this connective tissue skeletal framework. And this is really important in the new science of regenerative medicine. Okay, so you can see this person holding what was obviously a heart, but it's not red anymore. It's been washed clean of all of its muscle cells. It's been washed clean of its endothelial tissues that make up the veins. And what you can do now with this capsule is to seed it with stem cells and regrow an organ. And that's pretty exciting. So the whole topic of regenerative medicine is fascinating. And maybe I'll put something together for us to learn about that in a little more detail. Next. So here's a simplified diagram that may help you organize your thoughts around the path of blood through the heart. If we're going to just start here, we've been starting with the right atrium, so why don't we just do that? If I start with the right atrium, I'm going to pass through that atrioventricular valve. On the right, that's the tricuspid valve. The right ventricle passes blood into the pulmonary artery through the pulmonary semilunar valve, and that goes out to the lungs. Blood returns from the lungs through the pulmonary vein. Remember that arteries always take blood away from the heart. Veins always take blood to the heart. In this case, the pulmonary artery is unusual because it's carrying deoxygenated blood. Most arteries are carrying oxygenated blood. In this case, the pulmonary vein is odd because it's carrying deoxygenated blood, and most veins are carrying deoxygenated blood. Anyway, the pulmonary vein brings blood to the left atrium. Blood passes through the atrioventricular valve here, called the bicuspid valve or mitral valve, right? And that passes from the left ventricle into the aorta. Now remember, this is the aortic semilunar valve here. And then I take blood out to the systemic circulation. It goes to the muscles, kidneys, digestive tract, etc. Arteries bifurcate into smaller vessels called arterioles. And arterioles bifurcate into smaller vessels called capillaries. And there's capillary beds here in all these different tissues. And that's where gas exchange occurs. That's where the release of things like glucose and fats to the cells and the uptake of metabolic waste occurs. And of course, this deoxygenated, wasteful, blood full of waste gets returned back to the heart through the vena cava. Whether they're superior or inferior, they're going to return back to the right atrium, and that is what we call the cardiac circuit. Well, I'll put together a couple of diagrams to rehearse this content for you, and I'll see you Monday.